Let's take a look at the very first question. This question is related to the left ventricle wall segments. It asks which item is not related to the assessment in the parasternal long axis view. To solve this problem, you need to understand which segments of the left ventricle are visible in each view. Let's start by watching the related video. As you can see here, an ultrasound image is provided, and for each image, it is organized to show how the segments are divided. Rather than explaining this content separately, it's something you should simply memorize, so it would be good to just remember what's shown in this diagram. It would also be helpful to organize the corresponding coronary arteries connected to each segment. You probably won't be able to fully memorize this diagram after just a few viewings. So, review the video multiple times and organize the information as you go. In the question, they're asking about the parasternal long axis view. For the part that cannot be observed in this view, you should select the cardiac apex, which is listed as option D, as the correct answer. For the other items, please refer to the images I explained earlier. Let's move on to the next question. This one is also related to the left ventricle wall segments. This time, it is described as the parasternal short axis view. Here, the question is asking which part is not related to the level where the papillary muscles are visible. If you look at the image, it has a round shape like this. There are papillary muscles present on both sides. As before, for the item that cannot be evaluated in this view, you should consider the cardiac apex, which is option D, as the correct answer. Let's continue with the next question. This time, the question is asking about the wall segments that are not related to the apical four-chamber view. In the apical four-chamber view, you can evaluate the anterolateral wall, the cardiac apex, and even the lateral wall of the right ventricle. If you look at option C, the anterior interventricular septum is a wall segment that can be evaluated not in the apical four-chamber view, but rather in the parasternal long or three-chamber view. Let's take a look at the related video. If you look at the four-chamber image below, you can see the anterolateral wall on the side, and you can also identify the lateral wall of the right ventricle. There is a septum in the middle, and the area of the septum shown here can be considered the inferoseptal region. As for the anteroseptal region mentioned earlier, please note that it can be identified in the parasternal long axis or the three-chamber view. This was a type of question you could easily solve as long as you understood the basic anatomy shown in this video. Let's move on and look at the next question. This time, the question is asking which item cannot be evaluated in the apical two-chamber view. In the apical two-chamber view, you can observe the anterior wall and the inferior wall. You can also visualize the cardiac apex. Since the right ventricle outflow tract in option D is not related, D would be the correct answer. Let's move on and look at the next question. This question is asking about the definition of the boundary that distinguishes the mid-left ventricle. For this question, there is something you need to be careful about when solving it. This kind of definition is based on the criteria set by the American Society of Echocardiography. So keep in mind that there may be some differences compared to the standards of domestic hospitals or other countries. Please note that all the reference values and definitions covered in this textbook are based on the standards of the American Society of Echocardiography. Here, the question is asking about the definition that distinguishes the mid-left ventricle. The correct answer is C. The area from the tip of the papillary muscle to the base of the papillary muscle is defined as the middle segment of the left ventricle. Let's review this while watching the related video. As you can see in the video, this part is the tip of the papillary muscle. And this part is where the papillary muscle begins. So, if you draw it out, you can separate the area with the tip in the middle and the starting point and consider this section as the mid part. The lower part can be considered the basal area, and the section above that can be divided as the apex part. Just keep in mind that this is how the areas are classified. As I mentioned earlier, these defined sections are based on the American Society of Echocardiography standards, so I want to emphasize again that there may be slight differences depending on the textbook or material you are studying from. With that, we've solved the problem. Next time, we'll continue with the remaining questions. See you next time. Thank you.